Clarified Precision Medicine aims to make sure that all cancer patients receive the right therapy for them at the right time during their course of treatment. So we use our AI and our own curated knowledge base to identify, based on this patient's molecular tumor profile, what are all the different therapeutic matches that they could have, and then based on the current knowledge that's out there and our own history that we've captured in our database, which therapies are most likely to be recommended highly. I hope we'll work together to build on this platform that we've created to really help drive insights into clinical practice and really close gaps in precision oncology. My name is Daniel Rotroff, and I'm the Chief Technology Officer for Clarified Precision Medicine. Clarified Precision Medicine aims to make sure that all cancer patients receive the right therapy for them at the right time during their course of treatment. Yeah, so right now, when a patient's diagnosed with cancer, oftentimes they will have their tumor sequenced to identify mutations within the tumor that may make them vulnerable to certain chemotherapies or targeted therapies. And so what happens, though, the results that come back are oftentimes very difficult and complex to interpret, and they require a lot of expertise. So because of that, the tests oftentimes either aren't ordered for the patients due to the complexity of interpreting them, or it requires an expert panel to review these, and it's not very scalable. So it has that solution has difficulty meeting the demand out there. And so what Clarified Precision Medicine does is it basically create a scalable solution so that we can offer that expertise and that therapeutic guidance for patients at a level that can meet the demand for all patients with cancer. And so that was really what necessitated the development of Clarified Precision Medicine in the first place, was due to some of our clinical colleagues and founders essentially being asked to consult, to have their expertise help identify what the best therapy for patients would be. Right now, when a patient goes, they send a sample of their tumor, or a lot of times the blood will be sent off for a liquid biopsy, and it'll go to a sequencing lab. We work with any of the major labs in the country, and their tumor will get sequenced, and a report comes back with all the different mutations that they found. What we do is we take all those mutations, we ingest them into our knowledge base, and we identify therapies that are known to act or potential have resistance to those individual mutations. We then have our expert panel, precision medicine expert panel, review those and identify which therapies are the best for that patient. And we do this by leveraging AI to sort of scale that solution, offering the recommendations to the reviewers so that it's quick and easy and accessible to them. And then the reviewers can quickly identify, either they confirm that order or they can make changes as needed. But it makes it so that we can actually scale this offering while still maintain the clinical expertise that's needed to have that sort of hands-on guidance to give back to the physician. Yeah, so we kind of address two challenges on other ends of the extreme. So either you have an AI-only solution, which struggles to sort of keep up with the latest, greatest therapeutic guidance that's out there, because AI typically is trained on a lot of data in order to make recommendations. But a lot of times the latest, greatest thing is coming from a clinical trial where there's not a lot of data yet. And so we need to make sure that we're acting on the newest things and not necessarily waiting for a large body of evidence to accumulate. And so that's why a lot of the AI-only solutions don't quite meet the needs for patients today. On the other side, the manual panels that are assembled, the molecular tumor boards at large academic medical institutes, are very difficult to scale to meet the needs of patients. A lot of times they can only get to maybe 4 or 5 patients a month, and it leaves a backlog of many patients that otherwise don't have access to that kind of expertise. So we sort of address that by blending the best of both of those worlds. We use the AI to help us scale, but then we make sure that there's an expert at the other end to confirm that what we're doing is based on best practice. Yeah, I think a lot of our founders and our clinical colleagues really identified that a lot of physicians were not ordering the sequencing necessary to identify these therapies, mainly due to just the complexity of interpreting these results. A lot of times these results come back, they're 40 to maybe sometimes even upwards of 100 pages long, and they have multiple matches, therapeutic matches that may be on there, and it's not clear which one would be the best to start with, right? If you have 6 different therapies to choose from, which one should you start with? And so that was really the core problem that we were trying to solve, because the evidence is pretty clear. Patients that get on targeted therapies that are best matched to their tumor, they have better outcomes, they have lower adverse events, and overall, it's a better therapy for them. So what we want to do is make sure that as many patients get on those appropriate therapies as possible. And so by doing this, we can make sure that we increase testing utilization, we aid in the interpretation of those results, and help give the support to the physicians so they know that an expert has their back. It helps get the patients on the drugs, helps make sure that it'll get paid for, all with appropriate evidence meeting medical guidelines. There's multiple stakeholders that we serve. So the patients, of course, benefit by making sure that they get on the best therapy for them. So that's a clear benefit to the patients. All the evidence is very clear that these targeted therapies do better when patients get tested and put on those therapies as early in their treatment as possible. And then we also help the physicians. We help them not only give them some additional expertise that they may not have, but also we help, even when they do have the expertise, we help them scale so that they don't have to spend nearly the amount of time they have to sort of sift through all these pages and results, or sitting in molecular tumor boards that can look at our basically one-page report that gives very clear guidance, and it helps them so that they can meet the needs of all their patients more effectively. And then we also help the hospitals, because patients that get on targeted therapies generally have fewer adverse events. They're less likely to come back and occupy a bed due to a side effect of therapy or toxicity. So all these things end up really, it's a win-win-win across the board. AI is really helpful for us to help do the first step. We kind of like to say that we use AI to do about 80% of the lift. So we use our AI and our own curated knowledge base to identify, based on this patient's molecular tumor profile, what are all the different therapeutic matches that they could have, and then based on the current knowledge that's out there and our own history that we've captured in our database, which therapies are most likely to be recommended highly. We can say that. So we use AI to essentially prioritize our treatments. That does a lot of the lift, and then it generates a report. And then the clinical expert, the precision medicine expert, only has to come in and just verify if that's correct, or they can make changes if they feel like it's necessary. If they do make a change, we capture that. It feeds back into our system so that it'll be a little smarter next time. But we do that to basically help with that lift of bringing all the knowledge together, assembling it, and putting it so it's right there available to the reviewer, so that they can efficiently go through these reviews, making this scalable to where we could review thousands of cases a week, whereas oftentimes a molecular tumor board may only be able to do 4 or 5 in a month when they meet. A lot of time it could be related to the other treatments that the patients received, or basically having just expert knowledge in a cancer. A lot of, especially doctors in the community setting, they see all comers. They're seeing patients with all different types of cancers, and so having someone who's an expert in the course of treatment in this specific cancer, when you're choosing between 2 or 3 what seem like equal options, having an expert that knows how the pharmacology of that drug works in that setting, And what we found is that physicians, when they get our report, they actually change their recommendation about a third of the time. So that's a significant amount, time where the physician actually altered their course of treatment based on the guidance they received from Clarified. Yeah, so I think one of the things that we've needed really is we've accumulated quite a lot of data, and this data can help us gain insights into the clinical practices that we're working with, and they can also help us understand some of the gaps that exist, either within a certain cancer type or across cancer types. And that's where we wanted to work with Arionkoder to develop tools to help us, really get deeper insight into the data that we've collected, identify things like how often patients are switching therapies based on the results of their sequencing result. How often does a Clarified Precision Medicine test influence that? How often are the therapeutic suggestions that we give adding new classes of drugs to what was listed on the next generation sequencing report? We often find that not only does our knowledge base identify therapeutic options that weren't originally put on the next-gen sequencing report, but sometimes we remove options as well that aren't seen as ideal. The next-gen sequencing report may list 4 or 5 different options, and we can help narrow that down to the most appropriate options. And so gaining those insights on how we can help influence practice to make sure these patients are getting on the right treatment is something we really want to work with Arionkoder on, developing those tools so we can not only just create these reports more efficiently for patients, but really leverage the data that we're generating to highlight where the gaps are and how we can help close them. Well, I hope we'll work together to build on this platform that we've created to really help drive insights into clinical practice and really close gaps in precision oncology. Right now, there's a big need. There's still significant gaps, despite the therapies that are available, the science and research supporting it. There's still gaps in implementation, and I think the best things we can do together are help to highlight those gaps and see if we can develop solutions to them to make sure that we can help meet the needs of patients. Well, we hope to deploy this platform that we've developed, and I think it'll lead to a series of probably white papers and academic peer-reviewed papers that right now will highlight some of these gaps that right now are blind spots. We really don't know how often certain guidance is being acted on, how often it's consistent with what's considered to be best practices. So, I think that'll be the next step, is really to deploy the tool that we've developed to shed light on what's going on sort of behind the scenes across the space of precision oncology, so that we can better address those needs. I think the more data we can generate and those insights, I think, are going to be clear. So I would say the hard deliverables will be basically what we're able to deliver to the public, to the community, to the physician community, to the testing labs. I think those insights that we can help, because ultimately we'll want to work with those groups as well to sort of help close all these gaps. So I think our success is going to be measured by how we can reach more patients and make sure that they get on the right therapies.